Before we start, I'd like to invite our founder of Medic Footprints Malaysia, Dr. Selina Chew, to introduce herself and just speak a little bit about Medic Footprints Malaysia and what we're about. So, Dr. Selina.
Hi, good morning. Thank you all for joining us on a Saturday morning. I'm just going to introduce a little bit about who I am and what Medic Footprints is all about. So my name is Dr. Selina. I'm a medical officer. I graduated in 2010. So I've been a doctor for almost 10 years now. So how did Medic Footprints start? Well, Medic Footprints started when I was told by my head of department at that time in anesthesia that I didn't have a future in NS and that I should leave the department. So he told me this right after I had a slip disc. I had a slip disc, but I recovered after that. I just needed an extra 3 months to like fully recover till, I was like at my 100%. So he just said no when I asked for that light duty. He said, no, I think it's time for you to leave. So now I've been a clinician for almost 8 years now at that time, right? I'm so highly skilled in intubation. I'm so highly skilled in critical care. I know what to do when a patient collapses. I can predict when a patient is about to collapse. But at that point, when I was told to leave, I was tired of, working the grind day in, day out, 36 hours call, 24 hours call. It was just so tiring. I decided, okay, you know what? I'm just going to leave this and get out because I was tired. I thought of just giving myself a break. It was time for me to just take care of myself. So when I left, I went to IMR. Now, like I said, right, IMR is a different place. IMR is where you deal with machines, where you deal with data, with computers, petri dishes. Now, like I said, I was so specialized in intubating. I was so specialized in resuscitation. I was so specialized in critical care. I knew what to do when I had a patient, but now I'm out here. I'm not doing any of that. I'm supposed to churn out data, key in data, do some analysis on Excel, and I'm like, okay, how do I even use Excel? So then I thought like, oh crap, what else can I do? I don't even know anything, all these other hard skills, I didn't have it. And I thought to myself, oh, is this the end of my career? Is this the end of me? What else can I do as a doctor, right? I've always wanted to be a doctor since I can remember. So now that I'm out, I was thinking to myself, now that I'm out, I'm not seeing patients. What does that mean? Does that mean I'm not a doctor anymore? Am I still a doctor? If I'm not, then what am I? Right? All these questions started coming up and I was like, oh no, I don't know what to do. Is this the end? And then when I look around, I realized that, I'm not alone. My story is not one story. It's so many people, so many other doctors' story. They think that clinical pathway is the only pathway for us, but there is so much more out there. So when I decided to really start Medic Footprints was I had a friend, a very close friend. She moved. She was also quite senior with me in NS, and she moved to a different department, a different hospital, and the bullying was so bad that she suffered depression and she was suicidal, and she had to leave. She had to get out of that environment. She took psych leave and all that. But then after, when she was a little better, she couldn't see an outlet. She thought that, okay, I just need to get back into that lion's den, that same place that made me the way, that gave her all that suicidal thoughts and all that depression. And I thought, no, that there must be a better way, right? And here I am telling her, no, there's something else outside. Let's go explore. And she's like, no, I'm a doctor. I must see patients. If I don't see patients, then what am I? So that triggered all this. And that's when I was thinking Medic Footprints needs to be here. And Medic Footprints is not just me. It's actually everybody's story. We have a co-founder and we have a huge team. What we do is that we connect doctors with all the other kinds of careers that you cannot think of that needs doctors. There are so many industries out there. They are actually searching for doctors, someone with medical knowledge, because you see, when there are products that are created, when there's no input from doctors who actually understand the healthcare field, then this product becomes like irrelevant, right? It's not necessary, or you know that there's an experience that's not wanted. So don't sell yourself short. There is so much opportunities out there for medical doctors. Don't think that just because you are trained in a clinic, trained in a hospital, that's all you can do. There's so much more things that you can do. It's just that, you know, maybe we were not trained to see it. You know, I remember a consultant once told me that the eye can only see what the mind knows. So if you don't know what's out there, you can't see the opportunity. So that's why we are here. We're here to connect doctors with all the diverse careers that are available for us out there. And so I hope you guys subscribe to our mailing list. Go to our website, www.medicfootprints.org/Malaysia, and make sure you subscribe to our mailing list, because we are really expanding. We are coming up with some learning and development programs for doctors to pick up new skills so that you can transition into all these other careers seamlessly. Because say you want to go into hospital management, there are some skills that you have to pick up to get that. So that's what we are creating right now, so that we can help all these doctors to move into all these other careers seamlessly. So I hope you all will get the most out of it today. Thank you. Back to you, Basima.
Dr. Selena. So I've typed the Medic Footprints website link in the chat, so you guys can check that out after the webinar. So, okay, we're going to start our webinar now with our first speaker. He is Dr. Raymond Choy. He's a medical doctor by profession with more than 10 years of experience, and he co-founded DOC2US, which is a telemedicine platform since 2015, which is the leading telemedicine solution provider in Malaysia. And he left medical practice since 2020 to be the full-time CEO of DOC2US, bringing the company to the next level. So he will be sharing his experiences and his journey through his medical career and on telemedicine itself. So Dr. Raymond, without further ado, please take the stage.
Thank you, Basima. Thank you, Dr. Selena, for the brilliant introduction. Hi, good morning, everyone. And my name is Raymond. Hope everyone is safe, and to all our frontliners here, thanks for looking after our country. Basima, do you want to share the screen? So I'm feeling very honored to be able to share some of our journey towards for instance telemedicine or even entrepreneurship, right? As a medical professional. In fact, like what Dr. Selena, I had a brief chat with her this morning before this, right? And she is doing almost the same thing like me, right? So really venturing into something outside of medicine, outside of the clinical work. So like what she say, we are all clinicians. There are still a lot of things that we can venture, we can learn. It's really about continue to learn, continue to grow ourselves, right? So it's not really about only clinical, because there's so many other things, right? So today I will talk a little bit more about some of the spaces that we can actually explore and venture in the healthcare space, which is still related to healthcare and whatnot, right? So later we have a Q&A session. Thanks, Basima. Can you next, please? So next, yeah. So basically, a little bit of introduction of myself. So I'm from Malaysia originally and born in Ipoh, so Ipoh Mali guys, right? And so I did my primary, secondary school in Samtec Ipoh, one of the gangster schools that time, and then went to Melbourne to do my pre-U next. And then subsequently, I came back to Malaysia to do medical degree, right? So I joined IMU, International Medical University. So all this while, I always wanted to be a doctor too, so I used to have this vision, right, that, I want to help the needy, the patients when I was very young, and hence, because none of my family members are, is medical professionals or whatsoever. So hence I want to do something to help, right? And so that was a very naive thinking without knowing what's outside, right? The healthcare people, the people's need and all this, right? So that's a very, very, determined kind of, thing that I want to pursue. So hence I went to IMU, and then I did a training program. So I did my initial phase 2.5 years in Malaysia at Bukit Jalil, and subsequently I went to not University of Malaya, but University of Manchester in the UK. So I did my clinical years over there. So we did a training. So why Manchester? That time I was a Manchester United fan, so hence we were asked to rank the university that you would like to go. So I ranked, number 1, University of Manchester, followed by others, 2022, something like that. So I very, very lucky that I ended up in Manchester, and then I finished my degree, and then I continued my training, my foundation year training, and also SHO, senior house officer training and surgical training in Oxford, John Radcliffe Hospitals, and the NHS Trust. Next, Basima. So subsequently, after a few years of training and working in the UK, so I thought, I've been away home for quite a while. So hence I, decided to, and surgical wasn't for me at that time. And after exploring in the surgical training, then I thought, maybe it's not for me. I want to do something, more family oriented. So I went to Singapore, and because it's closer to Malaysia, my family members, so I went to Singapore, joined Raffles Medical Group, one of the private medical groups in Singapore, as a medical practitioners and general practitioners at the airport, station airport, running the 24-hour medical center. So we run GP practices, we run emergency services, travel clinics, and border screening and whatnot. That time, no COVID-19, but we were doing a lot, like Ebola, swine flu, all these, but that one was a big scale at the time. So yeah, next. So I was there for 7 years, and during my tenure with the Singapore side, and I founded, me and my partner, we founded this company with a product called DOC2US, which sounds like talk to us. We want patients to talk to us. I'm sure a lot of us here, you can relate very well that, often your family members, relatives, and friends always send you text, call you, or during your Raya, Chinese New Year, or whatever festival season, your relative friends will come to you, hey doc, what is this? What mole is this? What rash is this? Can my son take this medication? Things like that. So it just got us thinking one day, right? And what if those people without such access and privilege, where do they get the information from, right? So naively we thought, back in 2014, why don't we create one simple platform so that we can connect both, right, the healthcare providers and the public, right, so that they can communicate using a simple platform. That was very naive thinking of us back in 2014. So I had no experience in staff. I have no experience in business. So I went to my partner, and then we thought, let's do it. So 2015, we incorporated the company. We developed the whole application system and the architecture, all this. We took about 2 years. So it was a painful journey. And retrospectively, I wouldn't go 2 years because I would go for MVP approach, which is a minimum viable product approach, right? So you roll it to the public first before you start testing everything. Yeah, but that's DOC2US. And then until now, we are still running actively. Yeah, next. Next, please. Yeah. So next, yeah. So there are a bit of pictures, and so during my uni years, I knew time. So we have game. Next, yeah. Next. And during my UK years, and we were in Birmingham supporting Lee Chong Wei. Die-hard fans of Malaysian shuttler, all this, and yeah. So all these are Malaysian doctors actually in the UK. Next. And so fortunate enough to graduate. Next. And I went to Singapore with the family, and so some of my pictures are working at the airport. So not only sitting at the clinic, so we also do a lot of running around, attending emergency from vessel vehicle to cardiac arrest to thunder strike, all this, right? Because we have to look at after the whole airport, international airport. So we're talking about 60 million turnover in Changi Airport, right, in Singapore. So the traffic is crazy, and not to mention that there's an internal community about 40,000 employees within the airport. So it's a huge, like it's a small city itself. So we have to look after. So the 15 doctors kind of community with 60 nurses and ambulance and whatnot. So it's a huge team, medical team running at the airport. Yeah, next. Yeah, so because of that, I also got the chance to go into aviation medicine. So so looking after the pilots in Singapore. Yeah, next. Got married later on in Singapore. Next. And got a kid. Next. Yeah, so just showing a bit of the journey, right? So work-wise, next, please. So work can be challenging, right? So work-wise, so as mentioned before, it can fast. Yeah. So these are what I mentioned so just now. Next. Yeah, so next to some of the training which you guys are going through right now in Malaysia, so it's quite more or less the same, right? In the UK, the training, everything is more or less the same. Actually, you have a Gen Search, Gen Med, all these. Next. Yeah, so Raffles Medical, as mentioned. Yeah, so next, please. Yep, so back then, a few years ago, we already, doing all the infectious control in Singapore. Singapore is very proactive, actually, at the border. So we were running a lot of, multi-stakeholders drill, national level, for the Ebola drills and whatnot. And also, hence, Singapore is more prepared, relatively, for infectious disease from the border point of view, from the policy point of view. So they're more proactive. Even before I came back to Malaysia for good, I came back in February 2020. Back in 2019, I think October time, we were already actively screening Wuhan flights. So that one, initially it was Wuhan, right? Started from Wuhan. So Singapore side, we are actually actively and proactively already screening all the Wuhan flights coming, to Singapore, and with all the necessary quarantine and whatnot. So the process just started way before 2020 outbreak, actually. So when there's an international, like the China outbreak, everything is in place and kickstarted. So this is something that we really need to learn from the Singapore side, being such a proactive, policy maker, and the country really in terms of fighting with this infectious disease, and it has proven, right? Look at the numbers and the infectious rate in Singapore as compared to other countries, right? So yeah, next please. Okay, so during my Singapore time, yeah, next please. A lot of opportunities are given actually during Singapore time, and yeah, next please. So we launched the DOC2US app in 2017. So we have been in the market for 4 years at the moment. Next please. Okay, so always wonder, right, as a medical doctor, like all of us, right, and so what's the reason of us being the medical doctor, and also what's the reason of us actually coming out of medical practice and do something else, out of our comfort zone. So you need to know your reason very well, and before you go, right. And next please. Okay, so the reasons, it can be, a lot of reasons, right? So why do people go into startups or venture into a new business and whatnot, right? So of course, some of them is because of personal experience, they themselves or the clinician themselves or the family members, they actually experience some pain points where you need some solutions. For instance, you may have admitted your friends or your family members in the hospitals at a private sectors, for instance. And why would the payment take so long, right? Why would the administration, the registration take so long? So you feel the pain. Why would patient always need to wait for hours at the A&E? So you feel the pain point, and because of that, you have the strong feeling that I want to do something about it. I want to improve the status quo, right? I want to change, right? Change is always painful, right? But because of this personal experience, then you think, let's do something about it. And that's a very good reason, right? Because you want to help and improve the system, the community and whatnot, right? And some of the reasons why you want to create more values for the patients, for the healthcare providers, for the industry stakeholders and whatnot, right? And you want to solve problems, for instance. And of course, some really want to, all this while I'm very interested in entrepreneurship, doing business, creating something, and studying medicine is really for my parents. Yes, we have doctors like this, right? I'm not saying right or wrong here. There's no right or wrong. It's really about what you want and what's the reason behind, right? So they are entrepreneurs like this, right? And doctors, entrepreneurs, and whatnot. And of course, some looking for fame and money and whatnot, and which I don't think is sustainable if you look at this, right? Next, please, Fatima. Okay, next, the reality is, right, and when you want to come out, and I'm sure Selena will agree with me, especially when like me, you have kids, right? Really multitasking initially, because as a small startup, when you first started, right, everything, you do not have a lot of people around you, right? Everything you have to go very lean because you have to manage the cost, right? And so that you can survive, right, and sustain later on, right? So hence everything you do everything yourself, from website to whatever, right? You do everything yourself as much as possible, right? You learn. Some people even learn to code. Some people learn to program, right? Because you want to keep your costs really, really down so that you can maximize the benefits and values to the client, to the community and whatnot. Yeah. Next. Okay, next, please. So a little bit of briefing on what we are doing. Actually, we are the telemedicine solution provider in Malaysia, and we are the largest electronic prescriptions as approved by Ministry of Health and whatnot. And to date, we have done close to 400,000 e-prescription. With every single minute, we are generating one e-prescription at the moment. Yeah, next please. Yeah, so in terms of healthcare pain points and problems, I'm sure everyone is more aware than me. So we're talking about silver tsunami, right? Chronic cases are increased, expensive costs and insurance premium. In Malaysia, like it or not, people like to sell Medicaid, buy medication directly from pharmacy without prescriptions, without medical input, and these are all the known pain points. And some of the areas in Malaysia, we used to have a poor access to quality healthcare services and whatnot. And right now we have the sixth one, which is the pandemic outbreak, another big problem added to all these existing problems. Right, next, please. Yeah. So our solution is very simple, just to create a omni-channel, a simple virtual platform to connect the both, right? And be the healthcare providers and healthcare providers, or healthcare providers and the patients and consumers, right? And it's deemed to be more cost saving, more cost efficient, and of course it provides convenience and safety for the patients. Next, please. And so this is how we started. I'm not going to go into it, right? So with the vision and the mission statement and whatnot. Next, please. Okay, so some of the services that we have on the app, on the web as well. So online consultation is more or less, all of us are almost the same, but there are a lot of limitation restrictions. So hence you need to have a very strong clinical governance within your company to make sure whatever we practice is ethical and safe and professional. Yeah, next please. Yeah, so this ecosystem we have built so far for the past few years, and we have the teleconsult services, we have the whole pharmacy solutions, we have the brick and mortar businesses, and so it's a hybrid model, online, offline, working closely together and vice versa. So that is the more relevant healthcare services rather than everything offline or everything online. Because in healthcare you can't do everything online because there are limitations. Always we are asked how you examine the patients and whatnot, right? And how you do assessment of this. Yes, that's why you need offline services, but you cannot do everything offline because it's not going to be relevant anymore. And this pandemic outbreak has proven that online has a complementary role into our offline healthcare services, right? And even MOH is actually heavily adopting online services as well. Yeah. So we have general health content, all this to educate the public, to engage the public as well. Next, please. Okay, some of our strategic partners that we're working with, and we work closely with MOH, MCMC, and whatnot from the policymaker point of view. And we also integrate with MySejahtera app, and all these provide free virtual health advisory. If any of you want to do some voluntary work, right, and please approach us. We have more than 120 actually running 24 hours to actually answer COVID-19 related matters to the public, be it they are the positive cases, staying at home for self-quarantine and all this, right? They need someone to connect, to talk to, and we actually provide this platform for them, integrated into MySejahtera. So we are blessed to have 120 over healthcare providers voluntary to provide this service even until right now. So we started from last year March all the way until today. We still provide this service for free for the public. Yeah. So if any of you actually are keen to, you have this heart for the nation, to help the country a little bit, please approach us. We're welcoming all the healthcare providers. Yeah. Okay. Next, please. Okay, so we work with more than 500 pharmacy outlets, adopting the solution, really connecting doctors and pharmacists together via system and processes on the e-prescription, e-prescribing, e-dispensing, all this, right, in a way that we are bringing the NHS of UK in Malaysia to actually have a more enclosed and a controlled environment in terms of prescription and dispensing. Yep, next, please. Some of the corporate clients that we're serving, we're looking after some of the employees. We're serving close to 700 right now, mainly multinational companies. Next, please. Yep, so these are some of the efforts that we actually try to help the country in fight with the COVID-19 since last year, as I mentioned earlier. Next, please. Yeah, next, please. So some of the healthcare providers integrate with MySejahtera. Next, please. Yeah, some of the feedback from the public on our healthcare providers. We have a lot of medical officers as well, actually voluntary, coming to us and say I want to do something about it. So we do the background check, everything. So all good, and we list them on board, and when they're free, they can go online and see some cases. And we used to see cases where people are very, very anxious about whether they need to do the test or not. Nowadays we are seeing cases like positive cases, they themselves, right, with the whole family at home, with positive cases, and asking what's next. It was some of them even with complications, stay at home, and because a lot of backlogs and also resources issue, they're not able to reach out to the ambulance and whatnot, right? Some areas, so we are helping them as to work extra mile to even contact ambulance to have all these services for them. And all these are actually on a voluntary basis. Yeah, next please. Yeah, some of our doctors as well, the feedback on our professional doctors. So we are very blessed, right? I don't pay them. They don't pay me either. They really come up with the with this just like good medical footprint is really for the good cause. So likewise, this is a little bit of efforts that we can do to help the country a little bit and to help KKM to reduce a lot. It's not a big effort, it's not big things, right? But it can snowball to big effect actually if we can help every now and then with the to the public. Yeah, next please. Yep, so we even have psychologists as well to deal with mental health issue, anxiety, even low mood via the platform. Yeah, next please. Yeah, so this is us, myself, and I'm very good to point out that, right? So as a clinician, we have a very, we can be very short-sighted to a certain extent because of our skill sets, right? We only confine to clinical work and whatnot, right? Seeing patients. This is our training. And most, I think we are a bit good at communication skills, right? Talking to patients or this. But in terms of the commercial side and the corporate side, accounting, finance, HR, right, and all this, and even technology, all this, right? We do not have so much a skill set. We need to learn from scratch. Hence, right, if you want to do something else or you want to create something else, it's good to find someone that not similar to you. It's good to find someone that can actually fulfill your weaknesses. So you need to identify what are your strengths and your weaknesses, right? And get some skill set to skill set gap, right? To get someone and you can trust to actually co-found the whole thing. So that's why we are blessed to I have the right people with me from the very beginning. And Paul is actually our chief medical officer and looking after the clinical governance, looking after the doctor's interests and whatnot, right? And most importantly, implementing policies and governance on our practices and guidelines. And he was the #2 man in the public hospital, Sandakan Public Hospital, and he was a deputy director, but he also joined us after that, and because he see this is a way to go, right? Next, please. Yeah, so on that, right, and this is another option for a medical practitioner, right? So not only you are providing clinical service, right? Like Paul, his journey was like from medical, clinical, and all the way to administrative work in Putrajaya, and subsequently to the administrative work at the hospital itself on the admin side, like, as a deputy director. So this is one of the other pathways as well that you really you're keen. You can take up some MBA course and whatnot, right? And go into the admin pathway. So this is another pathway that you can join as well. So not only everything you must go into entrepreneurship and stuff, and because it might not mean for everyone, right? And yeah, next please. Okay, so one may ask, what would be your motivation to do this, to come out of your comfort zone? You must have some motivation. Most of the time, it's actually self-motivations, right? Next, please. Next, yeah. So next, so like I said, the motivation, can be a personal experience. You feel the pain points or some pain actually experienced by yourself. You lost someone else or whatnot, right? Touch wood. And so all this can be your motivations, or you really want to improve your financials at the moment and whatnot. So there are different kind of motivations that someone having, right? It doesn't matter whatever, but as long as the cause is correct, is right, then just go for it, right? Next please. Challenges, yes, it's full of challenges. Next, and when you want to start something, like medical footprint or this, right? I'm sure everyone will agree with me that you do not know where to go, right? You might have an ultimate goal, right? But the how part you do not know. You need to figure out how to go, how to get this, how to get the right people, the right resources, or this. And hence, as a founder, as a co-founder, or as a startup founder, right? One thing you need to learn is you need to be as resourceful as possible, right? Maximizing all your network effect and whatnot. Yeah, next please. And in actual fact, right, you're trying to paint the whole picture, but you really need to find all the puzzles to come together, right? And which is really, something that, is challenging and it's time consuming. But this is exercise you really need to do as well, to find all the right puzzles, the right people, the right team. Most importantly, it's about execution in anything that you want to do, right? And because you might have a crazy ideas, the best ideas ever in the world, right? And believe me or not, right? Whatever ideas that you're having, you think is very innovative, right? I can assure you, right, out of this world, right, there are thousands of people having the same ideas as you right now, right? You want to do something else, but how come there's no such solution in the market? Because it remains at the ideation phase, right? So we wake up, you continue. So what makes you different, right, is actually execution. Ideas are cheap, right? So this is very good bring home message is ideas are cheap, right? You want to do something else, you want to create values, you want to innovate, right? You might have idea, yeah, idea is a starting point, but it's really about execution. And execution really is about the team, right? So hence, like someone say the diverse team with each team member's own strength and capability, that's excellent. I'm not sure excellent advice or not, but yeah, so like Dr. Aisha mentioned, you're right, team, right? And it first is really about the team. Once you get the right team, that's where you can move, you can execute well. You will have a lot of hiccups and challenges and difficulties and failures, and that's part of the puzzle, right? And the key is execution, right? You need to do it, right? I always say Nike, right? Just do it, right? It doesn't matter whether it's wrong or right. At least you even it's wrong, right? You rectify fast, you bounce back fast, and go to the plan B, plan C. Plan A doesn't work, right? This is an experience that you will go through. Next, please. Okay, next. So these are some of the many challenges, some of the 6 of them. And when you want to start something, right? Time, everyone has 24 hours. You have 24 hours, I have 24 hours. So your time is excellent, right? How can you maximize and optimize your time? So this is another challenge. And how to multitask and things, right? Another challenge, right? Because when you are small, you can't be hiring 100 men. You don't have that fund size to or capitals unless you are a serious kind of seasonal entrepreneur. Then at ideation phase, people will fund you. But initially, you don't, right? You need to keep yourself very lean. So hence, these are the challenges. Execution can be a challenge, right? And human capital, how can you get people, sell them dreams and vision to buy your ideas, to buy your products and your solutions, right? And to join you and to really hustle together. So this is something that is very important, and it can be challenging, right? Engagement with the team, engagement with your customer, with your partner, with your strategic partners. All this can be a new challenge for you. And of course, funds. Without funds, you cannot do things. So how can you get the funds? Is it from MBF, Mama Papa funds, or from your savings, from angel investor, from friends, relatives, and even from VC and PE, right? Private equity funds. So that will be the later stage, right? And whatnot. So these are many challenges. Next, please. And most of all, next, please, is about your solution, really. You might have a lot of challenges, right? What's your ultimate solution? Are you really solving the real pain point, right? So a lot of times people come up with the solution first and then look for pain point. That's not the right sequence. It's really identify the pain point first, come up with the solutions that can actually address the pain point, and people can accept it, right? So we talk about product market fit later on. Next, please. Yep, so your solutions, right? I simplify it this way. So you always start with a vision, right? So you might have the vision, my vision is actually to reduce, right? In the future, people do not need to wait at A&E, right? When people get admitted to A&E, they will be attended straight away. So this can be your vision, right? Vision can be different. Everyone will have different kind of vision. So when you have this vision, right, then you have to sit down and come up, what are my values? What is my value proposition that I can put on the table to realize my vision? So that's where your solution. So before vision, then you have a pain point, solution, then you have a vision, right? And then you come with a value proposition. What's your value proposition in terms of yourself and the solutions? And then you need to strategize it, right? Once you come up with a solution, you need to strategize it. Who's my target audience? How am I going to the market, right? How am I going to sell it to my customers, my patients, and whatnot, right? And this can be part of your strategies. Who's your target audience and things like that. And subsequently, so once you have all this, you approach the team members. Look, I have this being drawn up. Do you want to join me? Let's work together. Let's hustle together. So you build your team, right? So once you build your team, let's do it, right? Execute, right? So you will be having a lot of challenges and difficulties. And you look at the last one, UX is a user experience, right? You might have a perfect design, but your patient do not use it. So you have to understand. So how do you understand? It's actually you do marketing, surveyor, and feedbacks, A/B testing, all these lah, right? Next, please. So success, I must say, if you were to come out of it, out of 10 or 100, let's say 100 startups, right? 95 of them fail. 5 of them will be able to succeed, right? the whole success route, right? If I may simplify it, it's within 4S, right? You might want to jot it down, this one. In the whole journey, it's about these 4S levels. First S is actually survive. You need to survive first, right? When it comes to any solution, you need to survive first. You need to find ways really hard, right, with your team to survive, right? Likewise, you know, at pandemic outbreak, a lot of companies are trying to survive because of the economic downturn and whatnot, right? Once you finish the survival stage, right, and then you know you're quite comfortable, right? So you were able to survive the downturn of this, right? The next stage is actually sustain. You need to sustain your business. You need to sustain yourself, right? So basically, you are finding the right formula to sustain your business right now at this stage. So once you're able to sustain for a period of time, say 12 months to 18 months, that's where you go up to the next level, which is scale, right? The scalability. You need to scale your business right now. So from 1 store to 5 store to 10 store, from 1 clinic to 5 clinics to 10 clinics, that's where you scale, right? And you scale your business, scale your customer base and whatnot, scale. Once you're able to scale up, you know, to the sizable manner, right? That's where you go to success, right? That's where you succeed, right? And mind you, this is not one directional way, right? So this 4S, at any point in time, you can fall back to the first S. And at the third S, you can fall back to second S, right? So it depends on the environment and how you, that's what entrepreneurship. Some people might be a big company, you know, they're a very successful company. And because of this pandemic outbreak, they went back to the survival stage. Yeah. So survive, sustain, scale. You might be scaling at this point, but because the environment doesn't favor you, you go back to a sustainability stage. Yeah. So this is how the entrepreneurship works actually. Yeah. Yeah. Next, please. Yep. So are you ready? Of course, I'm not actually asking you guys to really jump, you know, to start. You must have a good cause, a good reasons, right? This is just another options, another for the clinicians to think about it, and based on what we experience, based on what, you know, as a clinician, I went through. Okay. So once you have the idea, the vision, right? You know, you just go for it. Next, please. It's really about the dreams that you have right now, right? Next. Yep. And your dream must be purpose driven, of course, right? And always, you know, dare to dream big, right? You never know what's your potentials. Do not ever underestimate your potentials, because you never know that what you are capable of, because you are not being put at the test, right? So once you come out of comfort zone, that's where the test starts, right? So dream big. Your dream must be big enough that, you know, you feel scared, right? The dream itself is scares you, right? Like what, you know, one of the Virgin, you know, the Virgin founders quote like this one. Next, please. Next. Okay, so just a recap. So next, if you really want to do something about it, you know, have a vision, you know, think about it, what you want to do, right? And what's your value proposition? What are your strategies? Execute it, right? Execute it, involve the team building, all this, right? Next. Okay, so these are the plans. So you might plan, but don't do too long planning, because to me personally, I don't think it works. Like you do 3-5 years plan. That's not the way for today's weather, because things change every day. And this pandemic outbreak has proven that. So no point planning for 3 to 5 years, because things change. Your plan will change. It's really about how adaptive you are and how fast you actually react, right? And most importantly, how proactive you are. So probably we'll plan for the next 3 to 6 months. That's the max you need to do as a business. Yeah, don't plan for 5 years and 6 years. It doesn't work now, right? Next. Okay, next. So these are some of the business model that you might want to you might want to look up a canvas model, CANVAS, how you actually come up with a business model. So you have the value proposition, who are your customers, resources, finance, commercialization, revenue. All these are new things to clinicians, right? And it can be a one month of course that you might want to attend, right? But you can simplify it and go through some canvas model. You can actually come up with a business model yourself, right? You can Google canvas model or business model, something like that. Yeah. Next, please. Okay. So key elements to your business, you need to sustain, you need to scale, and of course, your products, your solution must be sensible. It's not like you shop sendiri, I think this will work, right? But your customer, your patient do not love it, right? They're not using it, right? You must be sensible to the consumers, to the patient, right? So you must be sensible, right? It shouldn't be shop sendiri kind of thing. Yeah. Next. Okay. Next. Okay, so you might ask, right, as a healthcare provider, what's my role in the community, in the ecosystem? Next. Your role has got a lot, actually, right? And you are the educator to the public. You educate the patients. You do public health, even though you're not public health specialist, but you have the expertise with the knowledge, right? And you communicate well. You communicate with the patients and whatnot. You are the bridge between the patients and the hospitals and the healthcare fraternity. And of course, your role is to ensure safety of the patients, right? And health and safety of patients, right? So there are more roles than that actually your health as a healthcare providers. Next. And the ecosystem of healthcare, always revolving around patients, right? Patient-centric care, as we always say, right? So we have an MDT approach and working as a team. So that's very important, yeah? I'm sure everyone is aware of this. Next, please. It's really about how you collaborate with each other. So the key is collaboration and integration. Yep, next. Okay, innovation. A lot of times we talk about innovation. A lot of times people relate innovation with technology. In fact, it's not. Innovation is not about technology alone. Innovation is about two words: to improve, right? You can improve a process right now that you're facing at the hospitals, at the clinics. You can improve the workflows. You can improve the paperwork, the lengthy paperwork, by digitalizing it, by shorten certain areas, right? By simplifying the things. So innovation, yes, a lot of times people relate to technology, but they're more than that. Actually, it's really about to improve the status quo, to improve the current pain points that you're actually detecting. Yeah, so that's innovation, right? Next, please. Next, please. So sorry about the repeat. Okay, so key take-home message, right, is Nike. Yeah, just do it. Next. If you forget what I say, right? So really, dare to dream and just do it. Yeah. Next. Yeah. So this is what I say, right? If your dream don't scare you, they are too small, right? Dream big, so big, right? Even though when you fall short, right? You fall on the cloud or even on the star. You might dream all the way to Mars like Elon Musk, right? But even though you don't reach it, you might fall short, right? It's still quite big actually at the cloud level or even at the star or moon level. So hence you need to dream big, but it must be realistic and sensible, right? You don't talk about, I dream that I can fly, with my hand, with my arms and things like that. It doesn't work, right? Now we have drone technology. It must be sensible. It must be realistic, right? You can't be too idealistic at some point, but you need to really dream big, because don't ever underestimate your potentials, really. Next, please. Okay, that's all. I think I'm on time, 10:45, just nice. I think I'll leave the Q&A sessions later. With the rest, I think we have the next speaker. So back to you, Basima. Sorry about the lengthy sharing. Yeah, that's all from me. Yeah.
No problem, Dr. Raymond. Actually, we still have time to go through the Q&A session. I think there's a few questions here. So I'll start with a question from Dr. Aisha. Hi, Dr. Raymond. She graduated from Manchester 2010 too. So she some friends in common. So her question is, what compelled you to come back to Malaysia instead of staying and growing your business in Singapore? And her second question is, do you think telemedicine will stay and prosper even after the pandemic?
Well, Aisha, nice to meet you, and I think we are same alumni, right? Manchester. I hope you were the Manchester United fan. I'm not sure whether you were, but thanks for the question. I think it's a very, very good question. To answer your first question, really, it's a very personal experience that I've been away since Form 5, away home country, for 10-15 years easily. And I always feel that Malaysia is home to me, even though I've been abroad, even though UK is very good, very conducive for doctors at that point of time. I'm not sure about now, yet I still don't feel home. I still feel very foreign, even though I have a good network of friends and and colleagues and whatnot and support. Likewise for Singapore, people will ask, Singapore has got everything, right? And in terms of culture, languages and whatnot, it's so similar to Malaysia, but yet it's easily 5 to 10 years ahead of Malaysia. Why are you still coming back to Malaysia? As I say, I still don't feel home in Singapore, and I always have the heart for Malaysia, just that I just couldn't find the right time and the right reason to come back. But that very moment, I decided, really, I need to do something about it for Malaysia, since our company is based and incorporated in Malaysia. and I really want to come full time to actually have more impact for the industry, right? So hence I decided to come back and you know, to move the family to Malaysia, and I feel home. I feel home and I feel related to the people that speak Malay. I'm not very good at Malay actually, but I'm trying to learn because it's been away, right? But I feel that, you know, people here are very warm, right? And I want to do something about it, and my company together, you know, that's why I pitched to my company, my team members, that let's do something about it. That's how we actually started the COVID-19 task force since March, and that was picked up by MOH as well. We did it not because of we were asked to do it. We did it because proactively thought we wanted to do something about it for Malaysian. That time we was during MCO 1.0, and we thought there must be a lot of people very anxious. What's happening now? What's happening next? By using our expertise, how can we actually close the gap and bridge it? So that's how we started, and I'm still very fortunate to be able to come back to serve the Malaysia even right now. And whatever I'm doing is very minute. The frontliners are doing the big things, right? We have a lot of frontliners. Actually, they are, you know, swapping every day. They are actually contributing the most to the country, right? So it really got me thinking. It really got me, you know, sometimes very annoyed that people are not following SOPs. You know, our frontliners are sweating like nobody's business, right? Even though I'm not a frontliner, I'm at the back end, right? I really empathize what our frontliners are doing, and you know, I can see how frustrating they are, right? And people are not following, going to parties or this, and they are swapping, you know, taking care of patients with the heavy, you know, hazmat or whatever, right? It's crazy because we heard so much of stories from our team members, from our doctors, or this. Yeah, so I think there's still more things we need to do, and we need more people to come back to Malaysia. There's a huge brain drain, you know, a lot of good Malaysians, talented Malaysians, be it healthcare providers and not, right? They're all in overseas, in Singapore, in UK, in the States and Australia. We need more people to come back to serve. And hence, I hope that I can be the, you know, one of them to come back to serve. The second question, telemedicine. If you ask me before COVID-19, telemedicine it was an alien in Southeast Asia. The adoption rate was very low, but because of COVID-19, it sped up the adoption rate, you know, to even, you know, more than 100%. And in China, the adoption rate of telemedicine is more than 900%. Can you imagine, because of the COVID-19? And the very good question you asked is, after COVID-19, does this stay? Does the chart, because the chart is like this, it's a hockey stick, right? The adoption is a hockey stick across industry, across all the players. But does this stay after COVID-19? It will dip a little bit. I believe it will dip a little bit, but the threshold will be much better than the pre-COVID-19, because people are aware, and we need more awareness and education on telemedicine. What are the do's and don'ts? What can be done? What cannot be done? So it's a collective effort from the whole stakeholders, be it healthcare providers, virtual and offline, and the policy makers, or this really to come together to see what telemedicine can do, what it can't do, right? It can do a lot of things, to be honest, and it has proven in the Western country and in this COVID-19 as well. So I'm very positive about telemedicine, and definitely it's here to stay. That will definitely have some impact, and this will change our practice as well in the future. Yeah.
Thank you, Dr. Raymond. There's another question from Kai Shin. How do doctors in the app come to diagnosis and give treatment through the e-prescription without examination, inspection, vital signs and all that? And how they are able to identify, like, if the patient needs emergency treatment, like even an ED, there's a triage team. Is there limitations to work on that? Like, or it might delay presentation to the hospital. How do you work around that?
Yeah, Kaijin, thanks for your question. I think that's a relevant question, and this is one of the most common questions asked by usually healthcare providers. Telemedicine is not a wonder, even though clinically in the physical side, right? You can't be 100% sure that your diagnosis is true as well. You need so much of things to support you. So likewise, because of the limitation of telemedicine, there are a lot of things that we can't do. It's really about identify what are the do's and don'ts, what are your limitations. So we need some form of training for our healthcare providers. Our healthcare providers are given a very crystal clear guidelines. What are the do's and don'ts, the prescribing policies and whatnot, right? For instance, your refill of your chronic medication, a lot of time, if you fulfill what we call the 3C criteria, control, if you show good control of your disease, compliance, you're compliant with the lifestyle modification and medication, and C, showing no cautious side effect. These are the bare minimum that we are able to refill your prescription. We don't actually change your routine prescription. We are a bit conservative. because we're still in the early phase, right? So for your review, even though we are doing every minute, we do one e-prescription, but we want to be on the safe side. If you look at the record, the database and whatnot in the whole world, right? There are two areas that telemedicine actually flourish a lot. Teledermatology. For dermatology, a lot of times, right, by video, by images, more or less you are able to diagnose, right? Eczema, how difficult can it be, right? All this and it's really about mitigating the risk and managing the risk. What are the potential complications if you have this delay, right? So it's a whole range of training needed for the virtual healthcare providers. And the other area is teleradiology. That's between healthcare providers and whatnot. And there are so many other areas that you can do, right? And yes, I agree with you, Kaishin, that we do not want to delay. Likewise, telemedicine, it can have a proper triaging system as well, right? NHS is you've been using it. You do telemedicine. Telemedicine is not about app, about video as well. Even telecall is a telemedicine, right? So that's how people do the telecall. If you think about the bad way, yes, you might delay. But if you think about the good way, you might actually expedite the referral to A&E. People tend to delay. The thing is nothing, it's nothing much, but end up it can be a stroke. Oh, I have a bit of slur speech, nothing like it's just maybe something else, right? You never know. So if let's say they have a platform, they have an access to actually talk to the nurse, talk to the triage team. Oh, actually that might be a stroke or something like that. You need to go. So if you think of a good side, right, it has its good advantages as well. Because a lot of time healthcare providers always talk about the bad ones, right? The delay. Yes, I agree with that. But most importantly, is really about your whole clinical governance, right? And whatnot, and the practice and the training and the awareness. A lot of times healthcare providers, because it's not in our training in the virtual space, we need to retrain. We need to learn, right? As I say, we are not the business entity. We don't run business. We position ourselves as a healthcare provider on the virtual space. Hence, you need to work with the offline as well. So that's why we believe in hybrid care model. So our doctors, let's say we need a physical examination, we refer to the physical clinic for the physical examination and whatnot, for lab tests and imaging, all this. Our threshold referral is much lower as compared to the GP clinics or hospitals, because we acknowledge our limitations. Yeah, I hope I answered your question, Kaishin. Yeah.
Okay, last question for you, Dr. Raymond. So, like you said, your motto, like just do it. Like from idea, you have to go to execution. But I think for a lot of people, they are afraid because of the jump into the unknown. So for doctors, we are too used to being in our comfort zone, doing what we are trained to do. So jumping into an entirely new field is a very scary thought for a lot of people. So what would your advice be to someone who wants to venture out but is afraid of like the insecurity, like financial insecurity or not knowing the skills? What would your advice be to them?
Yeah, thanks for the question. I think that's a very good question. Jumping out of comfort zone is definitely painful, right? Any change is painful. What we learn and from the industry, from the seasonal entrepreneurs, right? You look at all the successful entrepreneurs, they went through the pain, right? So first lesson you need to learn is, be comfortable with the discomfort, right? So you have to be very comfortable with uncertainties. It's filled with uncertainties because whatever you're venturing in, right? Yes, you might have a very clear vision and goal objective, right? But there's so much of uncertainties in front of you, right? If everything is so certain, right, then everyone will go into what you're doing, right? Because you're creating something new, you're creating new values. So you have to learn to be comfortable with uncertainties. When you wake up in the morning, right, there's so much of uncertainties, everything you're hustling. You have to learn to be comfortable with it. If this is something that you feel very uncomfortable, that means this journey might not be, appropriate for you. Then you might need to fall back to your comfort zone. I'm not saying right or wrong, but when you jump a comfort zone, that's where you grow the most. That's where you learn the most, right? And often, not to say all the healthcare providers, but a lot of healthcare providers have this issue, and this barrier is ego, especially doctors. Why would I, because as a doctor, we are very passive. People come to us and seek help. People knock our door and come to us. But when you come out of it, right, more or less, if I were to put, right, you are the salesman, you are the sales lady. You're trying to sell your vision. You're trying to sell your product to your customer, to your team, to your members and your partners. You are the salesman. You're no longer a healthcare provider that you have the ego. Ego can kill, right? So that is a barrier that I always tell my team, my doctors, right, really have to lower yourself. Even though as a healthcare provider, you shouldn't have the ego. Otherwise, you are not able to have a proper communication with your patient. Patient always look up at you, but it's no longer that time, the era, right? There's so many healthcare providers. Why should I really go to you? There's so many others, right? Really, it's about lowering ourselves to stay humble and stay hungry, and be hungry of more, to learn more. So when you come out of comfort zone, right, there are a few stages you need to go through, which is you need to learn new things. At the same time, you need to unlearn, because your capacity, you are so much, right? You think you know everything, right? You need to learn how to unlearn, and then subsequently you relearn, right? And it's a kind of glass, right? So if you go to a class, right, with a full glass of water, right, there's nothing much you can be poured to you, because you know so much. When you go to anything new, right, or the class you want to learn, right, you need to empty your glass, go in with an empty glass, and let people, them to fill you up, so that you can learn the most, right? And so this is my suggestion, actually. Yeah. So it's tough, it's painful, but you have to endure and embrace the pain and uncertainty. But it will be rewarding. The values, is money combined. If you can help the patient in just one another way, right, that kind of rewards, right, is something that you can't imagine, really, if you really are solving the right pain point in the healthcare segment. Yeah.